Assalamu alaikum. Welcome everyone on board. Actually, uh, some of the questions which are being asked frequently, I will be just trying to focus on those questions. Whenever someone pass a board or a fellowship exam or membership exam, whatever country you are in, there is a question what to do after it. So, if I just focus back on Pakistan, even some people who do MCPS or MS or FCPS, all of them, they have in their very strong compulsion in their mind to go towards Gulf countries. Okay, so I will just try to tell that what are the pros and cons if you are only thinking about going to Gulf, or the other options which they think is Ireland or UK. Okay, some of them think about Australia. Uh, None of them thinks about going to US. Okay, though if someone wants to invest their time, that the best possible option they have is USA. Okay, yes, it's a little difficult in the way that you need a little bit of consistency. Okay, if you want to go there. But if you just think what's the best, so that the best option for them is to go to US. How to do it? We will just discuss one by one what are different options and how to proceed with it. Just a second, please. Okay. So, because it's like it's just a myth that Gulf go gives very good salary and there are so many good things about it. Okay. So they don't consider the because that's what I'm saying, that there is a strong myth being told to them by their seniors, or even if the people they look by some of people like me who are settled in Saudi Arabia. But the things which when I passed even I came here as a resident. I had not passed even the finish my I have just finished my training, but I have not passed my exam. So I came here as a resident, and with passage of time, I like achieve whatever I could in my preceding incoming years. Okay, so the problem is that first of all, only in Saudi Arabia you can become consultant after 5 years. Okay, if you have done FCPS, MCPS after 3 years, like MCPS plus 3 years, they will become registrar. Okay, MS there is a question mark. Different people claim different things, but what I know, they consider it as MCPS. They don't know what MS is, because it's not clearly mentioned in the Saudi Commission portal. So unfortunately, there are a lot of claims about MS, but unfortunately, ground reality is that it's still not in the you can say that the book, the classification book. MS is not there. So even after 3 years, they will be registrar only, and they cannot become senior registrar or consultant. Fresh FCPS is registrar, and then sorry, fresh FCPS is senior registrar, and then after 5 years, as I told you, they become consultant. This is only true for Saudi Arabia. Okay, this is only true for Saudi Arabia. All other Gulf countries, including like if you think about other countries like UAE, okay, or Kuwait, okay, or this one, Qatar, okay, Oman. Unfortunately, in none of the countries they will be consultant. UAE, after 3 years only, they will be considered as a specialist. Okay, after 3 years. In Qatar and Kuwait and Oman, they will remain specialist forever. Maybe there will be some exceptions in also Bahrain. In some of the hospital, maybe I have heard that some of the people they are selected as a consultant. In even in UAE, the people who are there for 10 years, there is exceptional pathway for them. Some of them have become consultant, but this is very rare. Okay. For that, you need to work there as a specialist for 10 years or something like that. There is a very difficult pathway. So my suggestion, don't think about you Gulf countries. Now, even the country where they are supposed to get this opportunity of becoming a consultant, even that place is not like they are thinking, because there are three, four categories of hospital. The number one system is King Faisal. It's in some of the hospital. Their credentialing is very high. Even if you have the Saudi Commission classification as consultant, you cannot become more than assistant consultant in King Faisal. Okay, but that's the best hospital in Saudi Arabia. I was lucky enough to work here in King Faisal. The number two is National Guards. Okay, National Guards is with the name of King Abdul Aziz Medical City. It's in different four, five cities of Saudi Arabia. This is number two. Their credentialing is also almost the same. Rather, unfortunately, there is a category of a staff physician, which is actually like a resident, and people don't know about it. They think that it's something big, but it is like resident. You can say it's a sophisticated resident or a relatively higher paid resident, but it is resident. Then there is assistant consultant, and then there is associate consultant, and there is consultant. Unfortunately, there is some problem. National Guard even don't promote. There are some exceptions, and some of them are being promoted as assistant consultant, but usually even FCPS, they are staff physician and staff physician forever. They are not promoted usually. Then the third category is the university hospitals. University hospitals in Jeddah, Riyadh, Dammam, some of the university, or even in some of the smaller cities, there are some this university hospitals. But these university hospitals are also not like getting the people frequently. Then the fourth category is you can say autonomous Ministry of Health hospitals. There are autonomous Ministry of Health hospitals. Some are in Riyadh, like King Fahd Medical City, King Saud Medical City. I happen to work in King Saud Medical City, and there are some Ministry of Autonomous hospitals. The next category is like this is King Faisal, this is National Guard, this is University Hospital, this is Autonomous Hospital, and the fifth category is MOH very hospitals, and number you can say six categories private hospitals. So among private hospital, I will tell you before going to MOH, private hospitals usually there are the best hospital in is Salman Al Habib Group. Okay, and there are some other also good Hamadi Group. They are also good. Okay, but after that there are so many private hospitals who have 6 days of a week working, difficult environment, and they have less vacations and more responsibility. But of course, you can get a job in private hospitals. MH hospitals. This is the most frequently known hospitals to Pakistan. Maybe 10 years ago, there used to be every month or every 6 months or every 3 months, there used to be delegates who are used to come to Pakistan to take the doctors. Unfortunately, there are no more visits like that. So nobody is going to Pakistan frequently. Yes, usually still the recruiters, Al Najam International or Quraysh International or American International, or there are a number of recruiters who are still recruiting people from Pakistan, but unfortunately, very rarely. The specialities which have still more demand in Saudi Arabia, like anesthesia or ICU, or very few specialities. Like for example, if someone is in general medicine or general surgery or say general pediatrics, unfortunately, there is a big cross. There is a big cross. Unfortunately, least likely they are going to get job even in Ministry of Health, periphery hospitals. Others, no chance. Not no major chance of getting job there. Okay, so you should be knowing that these are all subspecialty hospitals which where they are getting the chances. Okay, so this is a big problem. Similarly, radiology is just ultrasound. Unless you have interventional radiology board or some certification for interventional radiology, it's useless. FCPS radiology unfortunately has not much of worth. And you go in details, there are basic sciences, they need PhD for basic sciences. What else specialities are there? Yes, subspecialty nephrology, and neurology and endocrinology and rheumatology. Yes, maybe if you have a specific board. Maybe you will like FCPS second fellowship or something. Maybe there are chance, but still, because remember one thing: in one hospital, maybe 10 anesthetists are required. Maybe one or two rheumatologists are enough. Maybe one or two endocrinologists are enough. So there are not much of opportunities. So that's why everyone who is passing FCPS or MCPS, they are thinking we will go to Saudi Arabia and they will be having red carpet. Unfortunately, not at all. So I will never recommend any one of you to think about Gulf. Believe me, maybe you people will be thinking that I'm a little hard, but that's a hard reality. The better opportunity for them will be that they should try to go to Ireland or UK, or because still and there is also saturation over there. So if they want to try their luck, okay, fine. But they will have to pass prometric exam. They will have to get the documentation. Then they will appear in the prometric exam. Then they will get the registration classification, sorry, and only then they can hope and they can try their luck. There are people who just pass MBBS and they are trying to get the prometric exam. Maybe one out of 50 or one out of 100 they are getting jobs, but they are spending so much money, and after that they don't know what they are doing. There are so many people who are going to UAE to get a job. Think about the population. Think about how many hospitals are there. Think about how many doctors will be required. Think about like what will be their future. If okay, even if they get the job, what will be the next step? You should not think about only 1 day or 2 day or 1 year. You should be thinking about your future. So there are people, sir, we will just have some saving and then we will go to UK or Ireland. I warn you, it's very easy. It's very difficult to come here now, and it's even more difficult if you get settled there somehow. In some of the hospital, it's very difficult for you to go ahead. So I will never advise you to start with uh, pass the FCPS. Have some planning of what you want to do in your life, and only do in that aspect. Unfortunately, without any thinking, if you are thinking to do something, it's useless. Okay, so these are few words. There are so many details about it. Maybe I don't have time to tell you in detail at the moment, but I'm just, if anyone has further question, I will be very happy to answer any one of you. Okay, so this is all about Gulf. Same is true for Bahrain and Qatar and Kuwait and Oman. You will have to pass their exam. Kuwait, maybe if some people are getting the job, yes, they give the time to do the registration over there. But still, basic rule is the same. You will get the classification, then you will be able to apply for the job. Even Saudi Arabia, once upon a time when I came, I appeared in the exam maybe after 1 year. But now things are totally changed. Yeah, we get the classification, only then we can apply for the job. Even some people get the job, but they don't get to process the visa till the time they pass the exam. So these are basic points about Gulf countries. In Saudi Arabia, there are only usually three places which are worth living: Riyadh, Jeddah, and Dammam. Which have direct flights. Yes, Medina have direct flights. Some of the schools are there, but if your kids are in classes above five, you should be thinking about their future. Okay, if they are not able to get a very good school, usually there will be some international schools which Arabic predominant, or there will be some Indian schools. Both of them are not suitable for Pakistani people. Yes, if of course, if you don't have any other school, you have to go there. But Ministry of Health periphery, very difficult to work. I have worked 1 year in periphery, and I was very lucky that I got rid of that place only in 1 year. And since then, I am in Riyadh. It's my luck. It's a blessing from Allah. But I know that the people living in periphery, it's very difficult. Majority of them, they are not able to keep their kids with family with them, and they are living an abnormal life, living alone. It's very difficult. It's not so easy. Yes, other countries like Qatar, Bahrain, and Kuwait, they are very small countries. They finish before they start. So they have population, very less population. So think about their population and compare it with population of our country. Even they are smaller than Lahore, or they are smaller than even Multan, some of them. So how can you expect that they will be open to anyone? There are people who are preparing for UAE exam. How big is UAE? Just consider how big is UAE, how many hospitals, and how will you able to get a good job and what will be your career progression. So think about it. Okay, so now I will take give a few words about other countries like UK and Ireland. Remember one thing, there are so many people who are appearing in different sort of exams like MRCP and MRCEM and MRCPCH, and the anesthesia faculty, they are FCAI and EDAIC and FRCA. The people are thinking that they will pass this exam and they will be yeoman. No, in UK, Ireland, the system is that the training is separate, the degree is separate. Even if you have done all these exams, but you don't have training, you are, it is just like Swedish with before a meal. Before training, you are nothing. So the training is CCST, Certificate of Completion of Specialty Training, or there is an alternative pathway which is Caesar, Certificate Equivalence of Specialty Registrar. Certificate of Equivalence of Specialty Registrar. In what is difference between CCST and Caesar? The thing is that in UK you have both in UK you have both opportunity of Caesar and CCT. This is that you will be able to show your papers, your credentials, your training, and you are just showing to them that I know this, I know this, I know this, and I am equivalent to your system. So then you will be you will be requiring some of the signatures, recommendations from the people with whom you will be working. If they allow you to complete your package, if you finish their requirement, maybe you will be get the certificate, and then you will be converted from journal division to specialty division, specialty registrar. Anyone going to UK or Ireland, they will require either their exam like PLAB or press, or they require some exemption. Either they will be doing PLAB or they will be doing press, or they need some exemption. That exemption may be a specialty exam or some any other exam. Like these, some of the exam, they will be giving you exemption from PLAB or press. Okay. So the advantage of these exams will be only that you will be getting the exemption, nothing else. Nothing else. Your experience, like for example, MRCP has no requirement. MRCM, I don't think so. There is much of requirement. Anyone 1 year experience or 2 year experience can do this. But what do you think? That if a person who has done FCPS or experience of 10 years, okay, and you have only MRCP, you have passed, you are very intelligent, somehow you are able to pass it, though it's very difficult. Part one, part two, maybe you will be able to pass, but press the sorry the OSCE part is very difficult. It's not easy. It's not easy at all to pass their Viva. Okay, so you need to be very good if you want to pass it. But still, I'm not saying that you cannot pass, but it's very difficult. But for example, if you pass it, what do you think? A person with 10 years experience and a person who is just graduated, 2 year experience, what do you think? Are the same? Not at all. Not at all. If they will be trying to appear for the job, their first thing will be their experience. Their first thing will be their CV. Their first thing will be their interview. And then, yes, if they are good, then they will look, okay, fine. You have done MRCP as well. This is different from what in Pakistan. Any donkey or monkey or horse have done FCPS part one, they will be able to get the training without any understanding whether that person is suitable for that training or not, because there is no evaluation. There is no system. We just need donkeys to work. There is no system of evaluation of the people. Our people are so hardworking, and then there are champions who are training. Who don't know even know the spellings of training, who don't know the spellings of supervisor. Unfortunately, I'm sorry to use a hard word. That's a reality. They are not training well. And then the exam, our exam is super. Our exam is international standards. Our training is African standard. Our exams are international standards. So even I think African people get training better than us in majority of hospitals. For us, the training is not good, unfortunately. And whatever we get is because of our own personal effort, not effort of our supervisors. And I have very hard feelings and very bad feelings for the people who are getting training in our hospitals. Yes, some of the hospitals are really good. Aga Khan, Shaukat Khanam, Shifa, or again, exceptions are always there. There may be some people who are fearing from Allah and they are trying to do invest some time. Otherwise, majority of our supervisor, they are not fulfilling their duty. So what will be the result? The result is in front of them. Result is in front of you actually. So this is the unfortunate. So anyways, coming back to Caesar, and the other pathway will be CCT. This will be that if they are able to get the training recommendation, they will be entering in the specialty division.
The other pathway is CCST, in which they get the training. Mind it, in Ireland, there is no CCT now. In majority, maybe very exceptional training in maybe GP or things like that. But otherwise, there is no CCT in Ireland. You all have to pass through Caesar pathway, and it's really difficult. Maybe 5, 6 years you need because the college will not support you. You have to finish their requirements by at your own. You will have to find jobs where you are able to get that rotation, that module, and when you are finished with your modules, yes, if you finish all the requirements, you will send your paper and then you will get the Caesar and then you will become specialist. This is the pathway you should know before going to pursuing to UK Ireland, because these exams are more yo man. People know more about them, so they think that this is the only pathway. They don't think about the last pathway, which I will be. Australia is the same. Australia, you have to pass AMC. And again, the population of Australia is 1/10 of population of US, if I'm not wrong. So there are very less number of hospitals and there are very less number of foreign graduates they require. They are self-satisfied with their own doctors. They don't welcome people coming from third world countries. Unless, yes, some people who are trained in UK, yes. After that, they can try to go to Australia, but not directly. So I'm not sure how many people will be able to get job on the basis of AMC. I don't have much information, but their system is that you will do AMC and then you will try to search for the job. The exam is very expensive. The tickets are very expensive. The staying is very expensive. How you will be getting the job, I'm not sure about it. Okay. But again, there are some opportunities in UK Ireland. Okay, there may be some opportunities there. Of course, they are better than trying for Gulf. Again, I repeat, I'm trying to compare. Now come the last but not the least is the US. US system, people don't know about it. Okay. Even the people who have done FCPS or they are doing FCPS, I request them humbly to USMLE. Don't be afraid of USMLE. And for them, anyone who is preparing for USMLE, the best pathway will be that coordinate or synchronize physiology, pharmacology, anatomy, pathophysiology, and medicine together. Okay, and medicine together, and this will be beyond the limit of step 1 and step 2. But if they coordinate these things, it will be very easy for them to pass. Okay, so this is more detailed that how they will do it. They have to do step 1 and then 2 and OET. Okay, and then step 3 in between. Yes, another what you say, step ladder. So you can use UK or UK or Ireland as a step ladder, because once you are in UK or Ireland, it will be easier for you to get the US visa. It will be easier for you to do some of the research. It will be easy for you to have improve your CV, improve your skills, improve your communication skills. You will be a much better doctor in after working 1 or 2 years in UK or Ireland, and then you can try for US. And then once you finish these things, you will be applying for there are, of course, the people only know about residency or match and everything. There is another pathway, backdoor, that is fellowship pathway. Okay. But for that fellowship pathway, you need to have some training. Like this pathway is open for the people who have done FCPS from Pakistan or even MCPS or MS. There is no word, sir, we get any advantage out of it? No advantage, but this is only your experience. So once you have got some experience, then you can apply for these. If you will finish your USMLE, you will be registered as in ECFMG, okay, and then you will be MD USA. Then you can apply on the basis of your experience. You can apply for fellowship program. Some people get residency as well. I know personally people who get residency by this pathway. Okay, but easier pathway is fellowship. Okay, relatively easy, because there are fellowships which are of subspecialty, and this is true for everyone. Like for anesthesia, there are obstetric anesthesia, neuro anesthesia, and peds anesthesia, and cardiac anesthesia. Similarly, for all the specialties, any specialty you are doing, there will be some subspecialty. Okay, like nephrology. I heard people even don't know about it. There is interventional nephrology in Pakistan. Not in Pakistan, in interventional nephrology. Who One of my friend did it, and I was surprised. What? Please explain what is it? So he told me this is just like maintenance of the fistulas. He's nephrologist, but his main objective is through endovascular maintenance of AV fistulas and factors which can improve the patency and things like that. So this is one thing. Okay. So similarly for gastroenterology, there will be some fellowships for rheumatology, for like oncology, like there will be and the website for it is IRAS. You can search through IRAS website, all the subspecialty fellowships for you. Even for surgeons, there are people who did FCPS from Pakistan. They get fellowship of transplant surgery. They get fellowship of surgical ICU. There are so many things. Once you do fellowship, there will be two, three options. If you are really good, after even one fellowship, they can enter you in their faculty. Okay. They can process your papers. They know you. You are a doctor. So you will get a state license. This will be one option. Some of them, they will require three fellowships. In fellowships, you will be getting around $5,000, which are enough for you to sustain. And actually, if you convert to salaries of a specialist in Saudi Arabia or any Gulf countries, it will be almost the same. In Saudi Arabia or any Gulf countries, you will never get a nationality. In these countries, if you live even in UK or Ireland, you will get the nationality of which is very important. Okay, so if you spend your few years there, if you do one fellowship or two fellowship or three fellowship or three or four fellowship, for example, that will be considered as your residency, and then you can get the state license, and your care future will be very secure. Some people, after finishing one fellowship, if they are good, they can get a chance to enter in the residency program. If you get residency in US, this may be the best you can get in your life, in this life of world. In like you can say, this is the Jannat of doctors in this world. Okay, so US is the best place for the doctors in the world. So if you are able to get this chance, for that you just need to do USMLE, and you can try your luck. So my humble suggestion to you, please don't be afraid from the word USMLE. USMLE is the best pathway. Yes, it needs efforts. But what do you think? In UK, Ireland, people, you will receive red carpet from the Prime Minister of UK or Ireland or Australia? Or if you are coming to Gulf countries, you are expecting their kings and their people to give you hayya hayya reception, a sword dance to you? No, not at all. There is a lot of struggle and there is a lot of nationalization going on, and you never know after 5 or 10 years, even I will be able to stay here. So don't think that Gulf countries, they are going fast. Their doctors are coming thick and fast now. And the subspecialties or specialties in which the work is too much demanding and they need a lot of people. Yes, maybe in my life, maybe anesthesia will not be filled, but other specialties, they are already filled. So remember one thing, you will not be able to get a job of interventional cardiologist or interventional radiologist or interventional nephrologist or things like that in US, in even in countries like Saudi Arabia easily. So for that, yes, if you are US trained, if you did fellowship, yes, if you don't want to stay there, finish your fellowship, finish your residency, you will be Abbu, you will be father of that subject in the whole world. You will be able to get a chance even in Australia. Even if you try to go to Canada, maybe you will be able to enter in their system, though it's very difficult to go in Canada. So just last few words about European countries. People ask about Germany, France, and everything. So basic theme, yeah, remember, you need to know the basic language of expert level, like their language, but not basic language, their native language to the expert level. I'm not sure B1 or B2 or whatever they call it, and then you need to pass their exam. Only then you can try. So it's very difficult. Even we are not able to speak English in the true sense in which we are studying since our childhood. We don't know even how to speak Urdu correctly. We don't know even Punjabi. So how will you learn a new language so easily? Yes, people can do it. I'm not saying that they cannot do it. So, but it should be for the people who are wedlock. It's easy for them because it will be their bread and butter. They have to stay there. They cannot leave their spouse, so they have to go there, whether they are a female or a male. Otherwise, it's very difficult and it's not advisable at all. If you exhaust your opportunity for US, UK, Ireland, Australia, then you can think about these countries. So this is not the first goal. So this is I have tried to summarize in this 30 minutes what you should do in your future. Yes, if you are in Pakistan, You can immediately try to have a second fellowship in any of the subspecialty. You can try to work in a better hospital, and you can, if you don't have the opportunities, go to a smaller city and get established over there. These are the things which you, and anyone who is listening, and you have any other counter question, you all are welcome to ask any question anytime. Thank you very much.